Hi, OCO, Shalom, Hola, Bonjour. Welcome to Life Means Go Forth. Life Means Go Forth on the daily. My name is Lady Means Go Forth. I am coming to you today from a concerned standpoint of a healthcare provider. I would like for you all to make sure that you communicate with your doctors and make sure that your doctors are communicating with each other. It doesn't matter whether it's an orthopedic doctor, orthodontist, or your primary physician. Each one of them need to know what medications you are taking, how often you are taking those medications. If you are told to stop a medication for one doctor, the other doctor should know that you have stopped that medication. Because if you were sent for blood work and you do not have that medication, they're going to notate it. They're going to notate that medication that's missing from your bloodstream, that you did not take it for that time. If they're not that specific doctor that has instructed you not to take it, then they're going to think that you just skipped that medication. So make sure that there is communication between your doctors as well as your healthcare providers. Space your appointments out. It makes more stress for yourself, your body, trying to keep up with the appointments. And if you're not supposed to take something in between that time, that gives your body time to recuperate from what you didn't take or what you should take versus, level it out. You'll be able to level it out. Don't be afraid to get a second opinion. If you feel that something's not right from what one doctor said, it's okay to call your other doctor and say, hey, do you think I should do this? Also, use your mind, use your common sense. When it comes to natural law and your birthright, you have a right to refuse anything. You have a right to refuse your medication. If you don't want that medication or that medication makes you feel funny or it's too many medications, you have a right to refuse. There are natural alternatives out there for your medications. So it's not like you're not necessarily treating the ailment itself. You just have to find an alternative to those chemical bases that you've been taking. So y'all please be aware of these things. There are pandemics that are supposed to be coming, quote unquote. Um, there's other things that are happening. It's about to be cold and flu season. They want you to take your flu shots, your pneumonia shots, your vaccines. Then you're taking these other medications. All those medications are going into your body, and your body is trying to say, okay, this is new. Can we do this? This is new. Can we do that? Can this coincide with this? Is this going to be an adverse effect to this? So, guys, be careful. Ladies and gentlemen, be careful. Communicate with yourself, your loved ones, your healthcare providers. Make sure your healthcare providers are communicating with each other. Once again, make sure your healthcare providers are communicating with each other. Because if one give you something and the other give you something and they don't know exactly what you're taking, something's going to set off. An adverse reaction is going to happen. It's guaranteed. So please be aware of yourselves. Love yourselves enough to think, let this person tell me this. Let this person tell me that. Okay, this is what this person told me. Make sure the communication lines are open so you don't have any adverse effects or reactions to things. Now, is something helping you control your blood pressure, your diabetes, your cholesterol, and they tell you to come in for some blood work. Do I take all my medications? And if I don't take all my medications, will you still know that I take these medications if you do not see them in my blood work? People, if your blood pressure is over 140 over 90, do not go for any procedures. Procedures are either going to raise your heart rate or it's going to lower your heart rate. But it's best for you to be at 120 over 80, 130 or less. Your top number be 130 or less for any procedures. Your bottom number should be between 70, no more than 90. It's called a systolic and a diastolic pressure. If you go for a procedure and you have a doctor's appointment for blood work, schedule your procedure a week or two after your blood work. Therefore, all your medications will be in your bloodstream, and if you are taking an anticoagulant for a dental appointment or any other procedure that tells you do not take an anticoagulant, you will have enough time and your body will have enough time for the anticoagulant to run its course. Some doctors, okay, you skip this today, that's fine. But if you are another healthcare provider and you do not know that that doctor knows that and that doctor said that it was fine, you have to continue taking your medications or they're going to say that you skipped your medication. Okay? So remember, have a regular blood pressure or normal blood pressure before any procedure. If your blood pressure have been running high, don't go for a procedure. It's more strenuous on your heart. It's more strenuous on your vessels. If one of them pop or one of them become constricted, it can cause a myocardial infarction, aka heart attack, or it can cause an aneurysm and or stroke. Be mindful, especially if you have had these vaccines and these other medications and your doctor or your nurse have written more medications for you. Y'all be careful. Think about yourselves. I'm thinking about you. And remember, life means go forth on the daily. We got to help each other out here. Peace.